Physical therapists who are trained in a little-known specialty are helping patients with pelvic floor issues live a normal life again. In tonight's Health Check report, a closer look at the therapy and how it works. Pelvic floor therapy is a specialized treatment for problems related to the pelvic floor. It's a group of muscles that help stabilize your core while assisting with essential bodily functions.
Its responsibility is for bowel and bladder function and also sexual function, but it's also a primary part of your core.
According to the National Institutes of Health, about 1 in 4 women has a pelvic floor disorder. Many encounter problems for the first time during pregnancy and after childbirth. Weakened pelvic muscles can result in pelvic pain, incontinence, and activity limitation.
You know, women are so often told, like, hey, you've had a baby. It's so normal to leak. It's very common, but that's not normal, and that can be taken care of.
Kiura has been doing pelvic floor therapy for about 3 months. Pregnant with her second child, she's experienced severe back and hip pain.
There were days I would just go home and start crying because of how bad the pain was. And eventually I was like, I can't do the whole pregnancy like this. There's no way I'm going to be able to make it.
Her physical therapist, Erin Musgrave, specializes in women's health at Baptist Health Therapy Center in North Little Rock.
Started out with working on, let's get that back pain resolved. And so we've been able to work through that and work through the hip pain, work on postures and positions and just different techniques for her day-to-day right now.
We'll do pelvic floor exercises where she's actually teaching me how to contract and relax during those contractions and bear down when it's actually time to give birth. So now I feel like I can actually go forward with the pregnancy.
All of this will also help with postpartum issues. Physical therapists want to raise awareness about this little-known therapy that has already improved the quality of life for so many women.
There's so much that we can address and so much that we can do to help. We want to be there for you. We don't want you to suffer.
And for more information on this therapy and where you can find help, just click on this story in the health section at KATV.com.